I guess two, one, they're sort of related. One's more methodological. We're trying to, is that when I think about, we're studying the relationship between age of marriage and presence of mother-in-law, I kind of wonder how that works or what you're actually measuring there, because we obviously, you can't have a mother-in-law until you're married, so you're getting something about, maybe that's something that people are marrying early have, maybe the causality may be reversed, that people who marry early tend to have mothers-in-law that have maybe, well, maybe because they married earlier, their spouses are younger, therefore their parents-in-law are also younger and therefore more likely to be alive or something like that. So if you could comment, I guess, on that. And the other, I guess, more general question in thinking about this, and or what I guess I'd like to see you speculate on is, right now you're mixing, I think, sort of some of these variables, survival of parents-in-law and actual presence of parent-in-law. And I suspect that the effects are going to differ a lot according to whether there was sort of presence or survival but not co-residence. Like in a patriarchal society, for example, where the wife or woman is living with her husband, obviously the parents-in-law affect, there's all kinds of reasons to expect something and so forth. So do you have, I guess the question would be, do you have any way of kind of sorting that out with the data that you're, to either eventually narrow in on either the data sets where you can sort out residence or co-residence as opposed to survival?
To take the first point, you're absolutely right. You can't have a mother-in-law till you get married. So there is a real problem looking at age at marriage and age at first birth, where age at marriage and age at first birth are very tightly correlated. There is a problem with looking at the presence of parents-in-law on those variables. We've included them in the analysis so far just as a comparison with the parental variables. But it may be that there are effects, for example, there tend to be correlations between the ages of the spouses at marriage. So if women are getting married relatively young in the presence of their parents-in-law, what that may mean is that they're marrying relatively young husbands. So but you're completely right. We need to explore that a lot more. You can't really look at the effects of parents-in-law on age at marriage and first birth because you don't have one until you get married. The second point was about the survival or co-residence. Yeah, again, essentially we deal with the data that we have. So if we only have survival, then that's all we can use. In many cases, however, I don't think it's a bad proxy, certainly in fairly traditional societies. To take the Gambian example, more than 80% of women married in their natal villages. So although it was a patrilocal community, in fact, the great majority of women had both their own parents and their parents-in-law nearby. So we only had survival status in that particular analysis, but I think that was actually a pretty good proxy of whether they were available or not. Where we do have co-residence, then we can use that data, and we do preferentially. In fact, the Thailand dataset is a really nice one because it also gives us information on how long a couple was co-resident with a particular set of parents after marriage. And for that particular dataset, we're using that time that a couple was co-resident with parents or parents-in-law, and actually we're getting really nice results. This is what Kristen's been doing in the last few weeks. We're getting some really nice results there that women who spend longer living with their parents-in-law have shorter birth intervals. You don't see the same effect for women living with their parents. So, but essentially the answer to your question is we use the data that we're given, but we try and interpret it reasonably carefully.
I have a question, and I guess two questions. So the first question is whether or not your data sets is unbelievably fabulous data. If you have information about parity, and if you plan to look at those effects. First question.
Yeah, there's information on parity, and then we have complete birth histories and the demographic and health surveys. Do you mean if there are interactions between parity and kin availability?
I would imagine. Based partly on Brooke's work and partly on my memories of childbirth, my first child, and then just thinking about it, is the impacts, and from the primate literature. So first births seem to be fraught.
Yeah.
Women are, especially where women are having their first birth fairly young. They're not necessarily fully grown. They have less experience. So that this seems to be these parental, you could imagine that the kin influences would play a particularly strong role on early parity births.
Yeah, we do have parity and we can look at those interactions. The nice thing about DHS is the huge sample size, so we can look at those interactions. With, again, using my Gambia as an example, you can't really look at those interactions because the sample size is too small. And what Kristen has been doing with the Thailand data is to divide up the analysis by parity. So looking to see whether the influence of parents and parents-in-law is the same across all parities.
Exactly.
And basically you find similar effects up to about parity 4 or 5. After that, parents-in-law don't seem to matter anymore. But then you get issues that a couple which has lived with the parents-in-law for the birth of 6 children is probably quite a selected sample. So there are some issues with the interpretation of that data. But yes, the answer is we do have parity and we can test for interactions because of the sample sizes. And we will do that.
Secondly, I guess, thinking about it, fertility always seems like a kind of hard measure to work with. Because as you said, it's not clear what's pronatal and what's antenatal, because really what what you're really interested in is lifetime reproductive success.
Yeah.
And giving birth early, giving birth late might, I mean, in different situations might be positive or negatively correlated with that. So in this huge data set, can you shift the focus from fertility, which is, you know, high fertility isn't necessarily a good thing, to lifetime reproductive success or completed fertility or any of those measures?
One of the variables we can look at is completed fertility or total number of surviving children, lifetime reproductive success. So we definitely do want to use those variables, but then you have a problem of what kind of kin availability index you use to correlate that outcome with. Because something like the length of a birth interval is a point estimate. So you can see whether the presence of a particular relative influences that particular birth interval. With lifetime reproductive success, you'd need some measure of how much of your reproductive lifetime you had kin available to you.
And at what point?
Yeah, exactly. So it becomes much more complex to analyse in terms of the kin availability indicators. So we'll need to think about exactly whether it's possible to do that on the DHS dataset and how we operationalise the kin availability. So if you have any suggestions, I'd certainly be glad to hear them.
Yeah, no, I see that. That's the methodological problem.
Yeah, we're starting with what we can do relatively simply with the data at the moment, which I hope is still informative.
I guess what you can do, I mean, what you might do is, so you do have reproductive histories, and you can actually, independent of the kin, you can ask, well, does giving birth early overall relate to have positive or negative impacts on lifetime reproductive success? And so you can, within your sample, and then if you see, well, parents are associated with an early age at first birth, you can then infer that that's either going to have a positive or negative payoff down the line. Something like that, right?
Yeah, and that's what we're going to try and do with this path analysis. Let me see if I can go back to the diagram.
Yeah, that's a fancy way of doing it.
So in the path analysis, the ultimate outcome of the path analysis is number of living children, reproductive success. And you can see how things like age at first marriage and age at first birth feed into that.
Yes. Yeah, right. So then you can cool. That's really cool.
Even then it gets a bit complicated because in growing populations at least, then early first births are more valuable than later first births. So even looking at overall reproductive success isn't the whole story, but it gets a more closer there too. Yeah.
Okay. So is co-residence what you use to mean presence, and is it absence of co-residence just absence? So what qualifies as these two terms? Then I have a follow-up question.
It depends on the study. Some have data on co-residence of women with certain kin. Some simply have data on whether certain kin were still alive or not at a particular point in time.
So co-residence means what?
Living in the same household.
Like in the same household. Okay. So follow-up, I guess, on that would be, so in the West, I would think, I mean, I don't know, but I would think that co-residence in the West would be an indicator of low economic resources, right? So that seems to be, I don't know, but that's what jumped out at me. That's why you have this reversal effect in the West. But if you're living with your parents or your brothers, something's not going right for you in your life, right?
If it's co-residence data in the West, it will be co-residence in childhood and the effects that has on your age at first birth. So if you live with your father in childhood, does that affect your age at first birth? Co-residence of adults in the West is pretty low. I mean, of more than one generation in the same household is pretty low. So Western studies that would look at the influence of kin on adult reproduction wouldn't involve co-residence data because it just doesn't occur often enough. And it's going to be correlated with things like socioeconomic status, although SES is always controlled for in all of these models.
I'm curious about sisters, so mother sisters, because it seems like if you take the cooperative breeding idea seriously, then there might be a limited resource in which you might have competition for access to these alloparents. So have you looked at sisters? Do they have because in one sense it's another pair of hands, in another sense it may be taken away from these broader networks.
There isn't a lot of information on the presence of kin other than parents and parents-in-law. I think there is a bit of research that suggests if your sister has a relatively early birth, you're likely to have a relatively early birth. So there may be some transmission of fertility within sisterhoods that way. But in terms of sisters helping one another out, there's really very little research on that. I wouldn't actually expect to find much evidence of sisters helping one another out either, because sisters are going to be involved, occupied with their own children. They won't be able to help their sisters reproduce. What's unusual about humans is that we have these non-reproductive individuals, which are grandmothers who can't have kids of their own, but also pre-reproductive children, particularly daughters, who can help women out to breed cooperatively. Which is one of the reasons I don't restrict the cooperative breeding definition in humans to helpers who suffer some kind of reproductive cost, because you have these grandmothers and pre-reproductive teenagers who can help out without damaging their own reproduction. But in terms of same-age sisters, I wouldn't predict there to be much helping going on because they're going to be occupied with their own kids.
So I'm wondering who the people surveyed in the DHS samples are. Are they rural residents, urban residents, mixed?
Mixed.
They're mixed. Mm-hmm. And then the fertility data is at the nation-state level?
No, it's all individual level data.
Okay, so it is from the same participants.
Yeah.
Fertility.
Yeah.
I guess I was wondering, because you didn't have this clear-cut divide between high fertility, low fertility nations or samples, if something like urban concentration or something like that, or market implication was swamping the effects, or I don't know.
Kristen has control for urban-rural residents in the models because urban fertility is usually lower than rural fertility. Actually, what we could do is look at the two samples separately. That's something we haven't done yet, but it is controlled for in the models. Mm-hmm.
I was just curious in terms of reproductive success lifetime. It's not just the number of living children, but in terms of sex composition of children might be different important in some societies, like patriarchal society, one gets into it.
There is some people in Cambridge, Molly Fox and Leslie Knapp, have suggested that grandparents may have differential effects on the survivorship of their grandchildren of different sexes to do with genetic relatedness. What they've suggested is that, let me see if I can get this the right way around, paternal grandmothers are more closely related to their granddaughters than their grandsons because of the way sex chromosomes are inherited. Therefore, paternal grandmothers should increase the survivorship of paternal granddaughters more than grandsons. And they gathered together 7 different data sets, including 2 of my own, to look at the effects of grandmothers on boys and girls separately, and found that actually paternal grandmothers do consistently seem to have a slightly more positive effect on granddaughters than grandsons. It's a very small effect. I mean, the genetic relatedness, the differential genetic relatedness is going to be very different. It's going to be very slight, rather, between grandmothers and their granddaughters and grandsons. But that's just one interesting idea, which needs a lot more testing about how kin may influence sons and daughters separately.
In 18th, 19th century Japanese data set that
Really?
the co-residence with grandmothers made the survivorship of female children, female infants. increase survivorship in infants.
Well, that would fit with our hypothesis.
Yeah, not
Mhm.
male infants. Yeah.
Yeah, that fits exactly with our hypothesis. I'm sure they'd be interested to hear about that. But in terms of affecting the sex composition in terms of reproductive success, I think, again, it's quite specific to the society. In Malawi, I found that maternal grandmothers actually increase the mortality rates of granddaughters more than grandsons, possibly because in that matrilineal society there's a lot of competition between matrilineal kin for resources. So maternal grandmothers don't want to have a lot of granddaughters around because it means their farms will be split up too much. So in fact, I think the influence of grandparents on grandsons and granddaughters it's an interesting area of research, but it's going to depend on a range of factors, including things like genetic relatedness, but also ecological factors.
A couple questions about the effect of fathers. So, in your second thing that you presented in the meta-analysis, it looked like the effect of fathers was at least as much as the effect of mothers in both the high investment and low investment societies on their children's reproduction. And I was wondering how you would explain that, or if that's not, if I'm misinterpreting that.
In the low fertility societies.
I think in both of them. So if you look at the green bar, it's higher for fathers than mothers, both in high fertility and low fertility.
Yeah. One problem with looking at mothers and fathers separately is that they tend to come as a unit quite often. So it may be hard to separate out the effects of mothers and fathers on a woman's fertility. But you're right that fathers do seem to be having more of an influence on their children's fertility than they do on their mortality.
Yeah.
The reason why fathers may not have much influence on child mortality is that in traditional societies, at least, men aren't having much to do with small children. You know, childcare is the preserve of women rather than men. Men do influence their sons and their daughters' fertility in traditional, as well as perhaps modern societies, through their social roles. For example, arranging marriages. Brooke found an effect on arranging circumcision ceremony of sons, for example. So it does seem to be that fathers have more of an influence on their children's fertility than their mortality.
I had a second question, which is more conceptual. So traditionally in the evolutionary anthropology literature, right, the idea is that humans, modern humans, because of paternal investment, there's greater pair bonding. And so do you think that if it's not the case that men are investing in their kids, does that mean that humans are less pair bonded than is normally depicted in the anthropological literature?
I'm not suggesting that men never invest in their kids.
Yeah.
I'm just suggesting that paternal investment is rather more facultative than perhaps it's sometimes painted. But pair bonds serve two functions. It's not just paternal investment, it's also mate guarding. And people like Kristen Hawkes have argued that a lot of pair bonding is in fact mate guarding. It's not much to do with paternal investment at all.
Yeah.
I mean, once you formed a pair bond, then perhaps the father might as well invest in kids because, you know, he's sitting there with nothing better to do. But the pair bond might have formed initially for the purpose of mate guarding. I think the issue of pair bonding is really tricky because it's very hard to separate out those two effects. People like Jeff Winkin have tried to do that with the Chimane data, which I think is a really interesting idea, to try and separate out those effects. But in practice, I think it's so hard to do. If a man is there, he's going to be both mate guarding and possibly investing in children. You know, how do you separate them out?
Yeah, I mean, I was thinking of it in terms of parental investment, the link between parental investment and the idea of parental investment making it such that males are going to be unable to invest in other things and reducing the variance between males and mating success. I mean, I know that's become a more controversial concept than it was back in the 70s, but it seems like maybe you're saying that's not a good model for why humans have things like reduced sexual dimorphism and things like that.
I think hypotheses about the evolution of certain characteristics they're really hard to test, and you really need to use mathematical models to do it, because you can't really use current empirical data to look at the evolution of any particular trait because of the difficulty of interpretation. But I do think the existing empirical literature does suggest that paternal investment is facultative. Men will do it in some cases, they do it a lot in some cases, and some they just don't. And I think you need to be quite careful when you're looking at men's role in the family, I think you need to interpret it very carefully. The default assumption has been in the past that it's all about intensive universal paternal investment, and I'm just not convinced that's the case. But I'm not suggesting that men never invest in their kids. Clearly they do. But really, if you want to look at the evolution of something like sexual dimorphism or any trait, I think you need to run some kind of mathematical model.
Kind of related to this debate, there are certain social institutions such as Leverett that kind of produce a replacement for the father. And I don't know if there are such institutions for grandmothers. And I wonder if there's some reason to believe that there are more kind of backup plans that for father absence that would mask the effect of father death or something like that in the first set of studies.
That's a really good point. I think you're absolutely right. In fact, probably what I should have said as well is that I'm talking about paternal investment being facultative and women not always getting paternal investment, but I think women more often get investment from men than they do from fathers. This is just looking at the effects of fathers. It doesn't look at the effects of men in general. So in the Gambia, they practiced the Leverett. One explanation for why the loss of the father doesn't matter too much for kids could be that 40% of widowed women marry their husband's brother. The kids stay in the same compound. That probably means very little change in their lives there. The new stepfather is in fact related to them quite closely. So it could be that one of the reasons for the lack of father effects is that other men are stepping in to take that role. You don't tend to get that with maternal grandmothers. So yeah, something else I think that's useful to distinguish between in the literature is help from fathers and help from men more generally.
Well, if there are no more questions, then let's thank Rebecca for the talk.
Thank you.